Consumers today can choose from an almost unlimited variety of poultry meat and egg products. These products are abundant, nutritious, safe, and very affordable. Decades of scientific research have enabled the poultry industry to implement practices which allow the birds to thrive in a productive and comfortable environment. Consumers today are very curious about how their food is produced and want to know more about specific issues. One topic discussed often today is antibiotic use. USPOULTRY has invited two noted experts to help us understand the use of antibiotics in the poultry industry. Dr. Randy Singer and Dr. Chuck Hofacre will answer questions concerning current and future use of antibiotics in poultry.
Hi, my name is Randy Singer. I'm an associate professor of epidemiology at the University of Minnesota. I'm a veterinarian and I have my PhD in epidemiology. The focus of my research program for the last 15 years has been really around foodborne pathogens and antimicrobial resistance and how to minimize risks to the animal populations, to the human populations, as well as in the environment. When I teach courses in infectious disease epidemiology to graduate students in veterinary medicine and in public health, we focus extensively on how we can create programs to reduce these disease risks to the animal populations and human populations. What we're going to talk about today with respect to antibiotic use. Antibiotics are a key part of a program to maintain the health of these animal populations. They have their potential risks, antibiotic resistance. And so what we're going to discuss today is how we try to minimize those risks from resistance developing in bacteria that affect the animals, as well as the bacteria that can be spread to people through food.
What is the difference in medically important and non-medically important antibiotics?
The term medically important or critically important when referring to an antibiotic, it's a commonly used term, but often a misunderstood term. When we talk about medically important, what we're trying to do is categorize antibiotics into their importance to human health. So organizations such as the World Health Organization or the Food and Drug Administration have tried to categorize these antibiotics that are used in animals based on their importance to treating severe illness in humans. This categorization scheme is intended to try to restrict uses of those antibiotics that are critically important for application in animal populations. What we would like to see then is that most of the antibiotics being used in animal agriculture are those that would not be as critical, as medically important to human health. The challenge becomes when we try to initiate a policy or a plan for treating disease. Often the antibiotics that are most effective at treating disease, whether they be in animals or in humans, are those compounds, those antibiotics that we would call medically important. Now in the United States, we use a science-based approach to decide on which antibiotics to approve and what those risks might be to human health. For example, in 2006, the Food and Drug Administration, Center for Veterinary Medicine, withdrew an approved drug for use in poultry, a class known as the fluoroquinolones. The human analog in that class would be ciprofloxacin, commonly referred to as Cipro. Now that move was made because of the perceived risk that the use of fluoroquinolones in poultry could have on the development of resistance against this critically important drug. That has left the poultry industry with very few options of drugs that are highly effective against serious disease. So as we decide which antibiotics are medically important or critically important, we tend to move then towards the use of certain compounds in animal agriculture that have absolutely no relationship to antibiotics used in human medicine. For instance, a compound that would be commonly used in animal agriculture is known as the ionophore. This is meant to control coccidia in the animal intestine. Over 1/3 of the total antibiotic used in raising chickens, for example, is going to be made up of this ionophore, which has actually no counterpart in human medicine. So if we were to focus strictly on the amounts of antibiotics that are being used, this is a very misleading metric because of the fact that many of the antibiotics that we would choose to use in animal agriculture have no counterpart in human medicine.
This video was brought to you by US Poultry and Egg Association. Funding for this video was provided by the International Poultry Expo. Please support our exhibitors.